So many people right now continue to struggle with mental health issues during the COVID 19 crisis. There is help out there. You just need to ask for it. Joining us now on the Oakland County MegaCast is Jaimie Clayton. She's the president and CEO for Oakland Family Services. Great to have you on the show again.
Hi, thank you for having me back.
For those not familiar with your organization, do you want to give us a little bit of background?
Sure, thank you. So, Oakland Family Services is a family service nonprofit. We provide prevention, education, and treatment. So, we really do a full spectrum of services from early childhood through preschool services, home visiting. We do foster care and adoption. And then the piece that you just mentioned, we do behavioral health treatment. So, we provide both mental health and substance abuse treatment services for children through older adults. We've been around 100 years this year, so we can mention that at the end, but we've been serving all of Oakland community for a long time.
Wow. And have you seen the increase in need for your services during this time?
You know, it's really an interesting time because we know there is an increased need. We're starting to see it trickle in, but also in my work, so for behavioral health, for mental health services, we don't just take Medicaid, we also take all the commercial insurances. And so people right now are really hedging their bets on if they can afford co-pays and deductibles for things like mental health service, if they don't know if their jobs are going to be there, or they may already have been laid off, or in the holiday time, their income is down and they're trying to save dollars. So we've seen a little bit in dip in services because of the pandemic, yet increased calls and demand. It's the follow through that sometimes is questionable. We saw this back in 2008 during the financial crisis also, kind of people don't see taking care of their mental health as a priority as they balance it against their economics, even though we know it is. And then all of a sudden, kind of the floodgates open and people start getting the help that they need.
So, if someone is laid off from their employment, does their health care continue or does that get shut off too? Or it just
So,
depends on the company?
yeah, it depends on the company. So, like at Oakland Family Services, we've done layoffs, but they've been temporary. So, in the past, not currently, we've been able to maintain somebody on their benefits. So, it's really an agreement between a company and their insurance provider, what contract they have. You know, people who are laid off have access to Medicaid, and we do sliding fee for people who don't have insurance. The people who we see that tend to wait are people who have insurance but don't know that they have the money for their deductibles or copays, which a lot of people don't understand that a provider like Oakland Family Services, we're not allowed to waive somebody's copay or deductible because your insurance is a contract between you and your insurance provider. So, say Blue Cross, for example, that's an agreement you have with whoever you have purchased that insurance from regarding what you pay for your copays or deductibles. So, we may have some leeway to say, well, you're in crisis, we're going to see you today, you can pay us next time, but we can't waive those fees completely. So, but we really try and talk with people about, you know, this is one of the most important things you can do. It's the same as seeing a doctor or getting your prescriptions, because if you don't take care of your mental health now, it could be a bigger issue later. So it's really about getting people to understand where this can fit in with the unfortunate economics of today.
I worry about this time of year. It can be hard for people with depression going into the holiday season,
Yeah.
but now we're adding a pandemic on top of it.
Absolutely. We talk all the time about how, you know, there's this feeling that the holidays are this wonderful time of year, which for the majority of people they are. However, if you are someone who is struggling with a mental health issue, depression or anxiety, or a substance abuse issue that can be very isolating, the holidays in and of themselves, as you say, are very difficult. Maybe you have issues with family or you don't have family, or just the stress of what is, you know, expected of all of us at the holidays, being happy, showing up, all of the stuff that goes with it can be very difficult in a normal time. So yes, now layer on the pandemic. So if you did think you were going to see your family, maybe you're not, or you have to make difficult decisions about not doing the things that you would normally do. The increased sense of isolation and despair that a lot of people are feeling as this is extended so much further definitely is amplifying what we see on both the mental health and substance abuse fronts. You know, I don't like to leave that substance abuse piece out because it's so important. And overdoses are up, substance use is up. So we have to look at all of that in light of both the holidays and the pandemic, and how do we reach out and provide people access to treatment and the supports that they need.
There has definitely been the argument on the flip side of COVID-19 and the virus, the side that's not really being talked about or factored into some of these statistics is what you just mentioned, the overdose and the substance abuse.
Yeah, I think a lot of times because of the stigma that comes with substance use disorders, it gets left off. You know, we talk about it in terms of behavioral health. So that encompasses someone's mental health and substance use. Most people who have a substance use disorder have a co-occurring mental health issue. They often go hand in hand. But the isolation and not having as much access to community meetings or treatment, and those are things that are more misnomers because those things really are out there during the pandemic, have added to those issues. And if you think about like what was one of the number one things being talked about before the pandemic as it related to behavioral health, it was the opioid crisis. That was splashed everywhere. And all of a sudden you're not hearing about that anymore. Well, I'm here to tell you that didn't go away because the pandemic happened. It went undercover. And so if anything, some overdoses went up. People were more isolated, or they were doing their substances on their own where, you know, they couldn't be revived in the same way by the group of people that they normally used with. So those are still serious issues for our community to contend with.
Yeah, I remember in the beginning, there was all this public training and community training for Narcan, and
Right.
there was a lot of talk, and it has pretty much gone away.
Right. And so we trained all these people up on Narcan, and then people are sitting at home using heroin or shooting drugs versus doing it in a group of people or with someone, access to someone else who might know if they've overdosed, to call somebody who's trained to give Narcan. So we keep just kind of beating the drum that, you know, support groups are happening online. And actually, ever since the stay at home, they were considered an essential activity, and they started back up fairly quickly. And we're providing the full spectrum of substance abuse treatment still virtually. So there is treatment out there. And then, and we can talk too, you know, the state has offered some crisis lines and some access to other vehicles to get support if you don't feel you're ready for treatment or you can't afford it. So there's lots of help out there. It just takes us to continue to talk about it.
When you're talking about some of the virtual community meetings, are people taking advantage of that? Because there could also be it's one thing to say, hey, maybe I can sneak away and go to a meeting.
Yeah.
But if you're stuck at home and you can't sneak away for that meeting, could they be skipping it?
So it works both ways. We see it on both sides, right? So I think what you're saying is absolutely true. And what we're hoping and encouraging for those people is that there are still community meetings happening. So don't stop going. On the flip side, one of the advantages, a lot of people with substance abuse disorders have been in the system for a while and they've lost their driver's license, or they don't have access to good supports and transportation. And virtual services have really changed the game in that sense because they don't have a reason that they can't, you know, log on to the computer. I think overall confidentiality and comfort with virtual services is something that we have to keep doing education on. It's something we've helped our staff with. We have concerns when it relates to domestic violence, right? Treatment was a way for people to be out of their homes, particularly women, talking about abuse at home. Now they're kind of stuck at home with their abuser and they're not going to like go in a bedroom and log on the computer and talk about that. So in those situations, we're still able to offer face-to-face services with all the safety protocols that would be needed. The same thing with substance abuse treatment. If there's someone not benefiting from virtual, we will arrange to do face-to-face services. I think people are weary of that because, you know, you're in an office, it's a closed office, they're not all 6 feet apart. And if you think about wearing a mask during treatment, it takes away all of the, you know, nonverbal cues that we're used to. So it's a real balance, but we don't want anyone who needs a service to not get it. And so we're really committed to figuring that out on an individual basis.
So we talked about the people needing your services. How is your staff doing during all of this?
I will admit it's hard. It's a struggle. We are working really diligently to support staff and help them feel connected. We're very excited. We won for our 7th year in a row, a top workplace in Michigan through the Detroit Free Press. And part of that's about our culture. And we have put a whole, strategy in place for supervisors supporting staff. It was daily for months and months until the stay at home, and now it's weekly update. So we're keeping staff really plugged in and really informed. But we've also really understand that work-life balance is so difficult right now for everybody. We've got staff who have kids at home learning virtually. People who are stuck at home with their spouses. When you say that, everyone cringes, like it's a great thing, but at the same time, people like some time away, and so it adds an extra layer of stress. Just how are people, therapists and clinical staff and people in foster care and adoption that have to support people who need it most? How do we also make sure they're taking care of themselves? So we're offering alternative work times and schedules. A lot of clients want to be seen at weird times of the day, early or late or after work. So we support staff taking some time off in the day if they need it, or working 4 days and not 5. And then we have some really creative staff who weekly do activities, scavenger hunts, trivia, just things to keep people plugged in socially and feeling good, because you miss that connectedness when you're not in the office as well, that makes a culture thrive and advance. So I'm worried about the staff every minute of every day, Ronnie. It has changed the whole focus of what a CEO does. I can't, but we're doing really well with that. And we have EAP services, so employee assistance services. If we have staff who are also struggling with their own mental health or adjustment to the pandemic, we refer them out to get counseling too, because there's no stigma for helpers to get help. We all need it.
So with that, can you talk a little bit more about foster care and adoption? I definitely think that's one arena during this entire pandemic that really hasn't been brought up to mainstream or to the public at all.
Yeah, and people may have seen, I think it was last week, there was an article in Bridge that got picked up by a lot of people. So many of us that do child welfare are very concerned. The number of referrals for kids with abuse and neglect is down about 50% right now. So if you think about that, who reports abuse and neglect the most? Teachers, people in the school system. So with virtual learning, we've really seen a switch in people being at home and those referrals not happening in the same way. I don't have an easy answer for that. What I can tell you is that with the Department of Health and Human Services guidance, our staff are continue to do face-to-face visits with birth families and foster families. We just came off a month of doing enhanced recruitment. Finding foster families during a pandemic is really difficult. So if you think about it, who's looking to open their home to children they don't know in a system they're not familiar with, who could have COVID? But we do still have kids in the system, coming in the system, that need safe and loving homes while we work with their parents. We strongly believe in reunification. Most parents want to have their children back. They didn't wake up one day thinking it was a great day to abuse or neglect their child, right? It's a whole host of things that happens to get people in the system. So we really work towards reunification when we can. And if not, we're working towards adoption. A lot of adoptive parents come from being foster parents. So we still really need that to happen. And we're really encouraging people who have eyes on kids, whether it be through Zoom family get-togethers, extended family get-togethers, or other types of contact, to report abuse and neglect if you think it might be happening. We don't want those kids to get lost in the system and then suddenly the pandemic to end and we're flooded with situations that we have to unwind because we weren't able to manage them during the pandemic. It is a real concern.
How do you do home visits right now?
So our staff are trained up on safety protocols. They all have PPE. We're providing that for them. We have put kind of the standard health attestations that people are used to now when you go into a doctor's office or some other visit that asks you, have you been in contact with anyone with COVID? Do you have any new symptoms? We've made that electronic. So our staff who come into our building or who are going into the community in homes have to answer that for themselves. If there's any yes, I get that immediately. They're not allowed to go to that visit and we explore, is it a mistake? Were you really exposed? Do you need to go get tested? And then on the same side, families have to complete those before we come to the visit. Any concerns, we don't do the visit, we refer them to their doctor. And then during the visit, we're doing physical distancing, of the 6 feet minimum, since we know now with aerosolization, it can be even more than 6 feet, and everybody's got to be masked up. So if a family won't wear a mask, then our staff are allowed to call a supervisor and get some guidance. We've had very limited problems with that. Most foster families and birth families want to see their kids. They want to be on a road to having their family reunited, and they comply with these same safety factors. Everybody out there is worried about it. And if a family does not want us in their home, then that's something we try to work out. There are some conditions by which we can still do virtual visits, but we do know that those visits are really crucial to helping ensure that kids are safe.
Jaimie Clayton with us here on the Oakland County MegaCast. She's the president and CEO for Oakland Family Services. Jaimie, a little bit earlier, you did touch on your 100th anniversary. What's ahead for 2021?
Yeah, so we're super excited. I'm not sure there's that many nonprofits that can say in one iteration or another they've been around for 100 years. And so this 2021 is our 100th. And what's so exciting is we've never really strayed very far from the original mission when the agency started as the Children's Aid Society of helping families build brighter futures, families that need us most. And again, I think there's a misnomer that it's just families who are in poverty or living below the poverty line. We help all families. We take insurance. We have families that get developmental assessments that are, doing very, very well. We just want to help families that have issues, solve them, and whatever that future might look for them, have that be brighter. And so we have a whole year of activities planned. We're going to have some different fundraisers and celebrations. We're going to be doing a whole social media campaign, interviews with staff and clients and board members, highlighting the 100th, and really launch into an exciting celebration of being around this long, but looking to the future. This pandemic is real proof that we'll be here for 100 more. Very excited.
Wow. Just imagine how many people you've been able to help through all those decades.
Yeah, it's really something. When we talk about touching the lives of about 40,000 people a year now. So yeah, when you multiply that all out and think about our touch, and then really when you know that you've touched and helped a family, you can also add some exponential change that happens just from that. So I know we continue to do good in the community, and I just can't wait to continue to celebrate that and show how we're going to be here moving into the future.
Well, we wish you the best of luck and want to say thank you too from the entire community for providing your services. I think here's one of the good things that may come out of this crisis. So many organizations like you and your team, you're getting the recognition and your services are being sought. Yeah. So it's okay to seek help. And if anything, that's the one thing I think that's coming out of COVID.
Well, and thank you for highlighting that and for having the vision to know that the more we talk about it, the more people will access it, the less stigma there is, the more we normalize that we all have tough times. And some of us just need some help to get through it. So thank you so much for having me.